And welcome back. The SwiftLift is an outpatient procedure that is a modification of today's standard facelift and is fast becoming state-of-the-art procedure for sagging skin of the lower face. Dr. Drake Vincent is the only surgeon to perform SwiftLift here in Utah. Thank you for being here, doctor.
Oh, thanks for having us.
So tell me a little bit about what it is. It's not the traditional kind of cut and pull the skin.
Right, we do, really it's just a modification of the traditional type of facelift. We do make much smaller incisions than we used to, much less undermining than we used to, which results in less bruising, less pain, less swelling, and much quicker recoveries.
Which are all good things. Good.
Right. In this fast-paced world that we live in, you just don't have time to take 4 weeks off like we used to. So
what is the downtime? What can you expect?
Well, you could have this procedure done on Monday, be back to work on Monday. I think that's exactly what Jan
So it's
did.
just a week vacation time, and then you're back.
Right.
And you'll just look fresh and relaxed from vacation, and no one will know.
Correct.
Is that right?
Yeah.
So here we have some before pictures.
Right. Here in these pictures you can see the main areas to really focus are the upper neck and the sagging jowls. This is 1 week after surgery. Back to school. Everyone's asking her, something.
Oh, if you lost weight, you look great. Did you just take a nap? That kind of thing, right?
And then this is 3 weeks.
So it focuses on the lower part of the face. Is that right?
Correct.
Okay.
Right. It won't really treat the eyes, the eye area.
But look at the difference that makes.
But it really can make a difference even underneath the eyelids.
Yeah.
Can help that area, and it just really. I mean, most people really don't want that. Joan Rivers.
No, Joan Rivers. No, there was a survey done, and she's the celebrity that no one wants to look like when they go to have anything done. So, Jan, are you happy with it? This is Jan here. Look how gorgeous she looks. Were you nervous or scared, or what made you want to be one of the first to try SwiftLift?
I think like every woman my age, I looked in the mirror and I'd do this pull-up thing and think, gosh, that looks a lot better. And when I had the opportunity to do something that was so much less invasive and short downtime, I decided to do it, and I'm thrilled.
And did it hurt?
I don't know if I'm different than most people. I never even took a pain pill afterwards. I used over-the-counter drugs. So there was some discomfort, but nothing severe.
Sure.
No.
Now, where do you make the incisions?
The incision is placed just in front of the ear.
Okay, so it's kind of hidden in your hairline then.
Yeah, and we can even show. I mean,
you probably can't even see, but it's just right along here
where the incisions are.
Tell.
And then, for the first few weeks, you have some redness, and we use scar gels. But one thing is, it's not the new contour lift or the thread lift like some people are trying to advertise. And I've done that before in my fellowship training and wasn't satisfied with it, and started doing this. And probably 90% of all my facelifts now are SwiftLifts.
Really? So you have other pictures to show us, right? Because I love before and after.
It's got just kind of talking about the procedure itself.
Okay, let's see what happens here.
The traditional type of facelift, this is all the undermining that I used to do in a traditional facelift.
And tell me what undermining is.
Once I make the incision in front of the ear and up into the hairline, which I used to make it a lot higher.
Okay.
And I'd make it a lot higher, and what that would do too is it cause those wrinkles that a lot of patients would get right here. It's kind of a telltale sign of a facelift.
Okay.
And so what you started doing is made the incision a little bit lower with the SwiftLift here. The incision is pretty much the same in front of the ear. But in the traditional facelift, I used to carry it all the way up behind the ear and way back into the hairline.
That's a lot of cutting.
Correct, yeah. And so what I did is I put staples all in here, staples in here. I get patients call, my staples are bothering me. So we started doing dissolvable sutures. So I do dissolvable sutures here now. The incision goes...
That's about half it's less than half the space.
Less than half the incision. It tucks just underneath the ear. It's camouflaged very well. You can't even see it in about 3 months. It's hard to even see the scar. Now, after I make the incision, then I undermine the skin. I separate the skin from the underlying muscle and underlying other structures, and undermine my scissors. Go all the way out underneath the chin, all the way towards the lip. And I started looking at my results. There was a new modification back in 1999 by a German surgeon, and we started looking at it and said, let's just modify what he did. Do a smaller incision, less undermining, and I was getting the same results.
Really?
And patients were
so
much
that's even
happier,
better.
Much
Look
better.
Look at this, even just through the neck and the jaw. It takes a good 20 years off.
Occasionally do a little bit of liposuction under the chin too. It's all part of the lift. I don't charge them anything extra. I'm just trying to get the best results that I can. And I think Jan did not have liposuction under her neck, and she still had amazing results. And
she looks great.
So there's that, and this is just kind of an outline of,
Okay.
you know, what is the Swift, what makes it different than a full facelift? And really, you know, the SwiftLift lifts the jowls and the saggy upper neck. It's less invasive, smaller incisions, recovery anywhere from 3 to 5 days. I use local anesthesia with a light sedation. There's no intubation, there's no ventilators involved. It's very safe. We use dissolvable sutures. The cost is anywhere, it can depend on the patient, what they need, but it's, you know, right around $4,600 for everything.
And lasts 5 to 10
years,
which is great. Now, Jan, this is Lori, your daughter?
Yes.
Can we get a good close-up of mom and daughter here? Do you guys get mixed up for sisters all the time now?
We haven't lately, but 10 years ago we did, so I'm hoping that's going to start again.
Well, congratulations.
Thank
you both
you.
look great. Doctor, thank you so much for being on.
That
is the SwiftLift. You can call 1-888-470-3223. That's 1-888-470-FACE if you're interested in information on the SwiftLift. Thank you so much for being here.
Thank you.
Thank you.
You look great. Thank you.
Thanks.
We'll be right back.